consultant, pediatric hematology and oncology from Apollo Hospitals, Navi Mumbai. I'm here today to talk about sickle cell anemia on the occasion of World Sickle Cell Awareness Day, which is celebrated every year on 19 June. Sickle cell disease is a world health problem and it affects nearly millions of people worldwide. Every year, nearly 3 lakh babies are born with sickle cell disease, and India is responsible for more than 50% of this burden. Sickle cell anemia is an inherited disorder of the red blood cells in which you inherit defective sickle cell gene that affects the oxygen carrying protein hemoglobin of our red blood cells. So when a child inherits one defective sickle cell gene, he becomes a carrier or a sickle cell trait. And when the same child inherits both the defective genes from both parents typically, then he becomes a manifested sickle cell disease or sickle cell anemia. Now what happens in sickle cell anemia? The normal red blood cells, which are biconcave, disc-shaped, they can easily flow through tiniest of blood vessels throughout our body carrying oxygen. However, the sickle cell red blood cells are C-shaped or crescent-shaped and they are slightly more rigid. So first of all, they have a reduced lifespan. So there is anemia because of hemolysis. And secondly, they get stuck at the tiny vessels in our body responsible for the various complications of sickle cell disease. So these children with sickle cell disease start presenting after the fetal hemoglobin goes away, that is about 6 months of age. They come with painful swellings of the hand and feet. They present with anemia, recurrent febrile episodes, recurrent infections. Many a times, sickle cell patients also come with severe painful crisis which requires hospitalization, especially when there is infarction in the chest. So they can present as an acute chest syndrome. Also, some babies present with stroke. So when there is occlusion of the major blood vessels of the brain, they may come with stroke. And also there are some complications common in adolescents when they present with avascular necrosis of the long bones. So these are some of the dreaded complications of sickle cell anemia. And what happens is, or what triggers these painful attacks is, any difference in temperature. So when the child has fever, when the child is dehydrated or is having recurrent infections, then they can trigger or they can precipitate this painful attack. And often in India, this disease is common in central India as well as the tribes of southern Gujarat, basically the scheduled and the tribal castes. So this is a neglected disease in India. What you must do is 5 must-dos for these children is to have regular visits at your doctor so that he can have regular checkups, whether the child is anemic or not. Is he having some repeated painful episodes? Does he require blood transfusion? And he puts you on regular doses of medications, especially something which is hydroxyurea. It has to be taken every day by the child and you need to monitor your blood counts while you're on that medicine. You need to look for chronic complications like stroke or any kidney damage, eye damage, which has to be monitored on a regular fashion. If there is severe anemia, you may need blood transfusion. Also, prevention of infections is very important in a child with sickle cell anemia. So you need to have a very good balanced diet, plenty of water, which will prevent these painful crises. And you need to take your vaccinations, pneumococcal vaccine, your typhoid vaccine, which is essential for a child with sickle cell anemia. Other than that, what is the best way of not getting sickle cell anemia? The best cure is prevention. So we at Apollo Navi Mumbai have a comprehensive pediatric hematology and genetic clinic where we pick up this disorder at birth. So newborn screening is offered. Many a times when we know that parents are carriers, we also offer antenatal counseling. And upfront we are cautious that this child is going to be having sickle cell anemia, so we can tell them what to do and what not to do. Second curative modality for sickle cell anemia is a bone marrow transplant. But are all patients eligible for bone marrow transplant? No. Only those who have a severe manifestation of sickle cell anemia. So those who are having debutylating avascular necrosis, recurrent strokes, when they require exchange transfusions or repeated episodes of blood. So when the quality of life is really impaired and the phenotype of the disease is severe, then these are the candidates for a bone marrow transplant. As the toxicity of the procedure of transplant itself is very high, so we have to outweigh the balance and the risk whether that child requires a transplant or not. Thank you.